Hello, everyone. Bonjour à toutes et à tous. It is my pleasure to be with you virtually today. J'ai le plaisir de pouvoir partager avec vous quelques réflexions sur la réponse à la pandémie de COVID-19. I would like to acknowledge that Ottawa, where I filmed this video, is located on the unceded territory of the Algonquin Anishinaabe Nation, and I thank the Algonquin people for their stewardship of this land. I want to begin by thanking all of you for your dedication and perseverance during this difficult time. There are many other important global health issues which have not gone away just because COVID-19 is here, and I want to acknowledge your continued efforts in addressing these issues globally. COVID-19 is an unprecedented health, economic, and social challenge, the likes of which the world has not seen in several generations. Here at home, with our collective efforts, we were successful in flattening the initial curve over the summer months. However, we have recently seen a resurgence of cases across the country. While we continue to manage the pandemic, it is also important to reflect on what we have observed and learned in the past few months. COVID-19 has not impacted everyone equally. This is something that has been observed not only in Canada, but around the world. The pandemic has laid bare the health and social inequities that existed before COVID-19 spread globally. These differences are not random, but fall along the lines of populations that have historically experienced health and social inequities. In Canada, for example, long-term care residents have been hit the hardest, accounting for approximately 80% of COVID-19 related deaths by the end of August. And although national data on racialized populations has not been available, evidence is beginning to emerge that communities with a higher proportion of visible minorities have higher mortality rates from COVID-19. We also know that women have been disproportionately impacted by the pandemic. In Canada, women represent the majority of health and personal care workers, including nurses' aides, orderlies, and client service associates. The staff in these positions are frequently precariously employed, which has necessitated them taking jobs in multiple settings, putting them at increased risk of infection and transmission. Of all Canadian workers in these types of positions in 2016, 31% were immigrant women. There are also concerns as some jurisdictions have observed an increase in family and gender-based violence in the time of COVID-19. Job losses have disproportionately affected women with small children and families. And since women are largely represented in the service and retail sectors, coupled with the absence of childcare, many will be unable to return to the workforce. We must continue to shed a light on these inequities to catalyze action and ultimately to create a more inclusive Canada. Canada has a long-standing commitment to gender equality, and we are recognized as a world leader in this space. There are many examples of policy progress, including Canada's commitment to using Gender-Based Analysis Plus, or GBA Plus, as part of the ratification of the United Nations Beijing Platform for Action, and the inclusion of gender identity and gender expression to sections in the Canadian Human Rights Act and the Criminal Code, supporting protection of trans and other gender diverse people from discrimination and crimes motivated by hate. During the pandemic, the Government of Canada has brought a gender lens to all aspects of its international assistance response, in addition to funding gender-specific initiatives, such as the UN Trust Fund on Violence Against Women for a COVID-19 response window. Since May, $100 million has been provided to support shelters and organizations providing supports and services to those experiencing gender-based violence. At the Public Health Agency of Canada, we continue to advance sex and gender-based analysis in our surveillance, research, community-based programs, and other key public health functions. This includes how we are responding to the pandemic and understanding its gendered impacts. It is important that this momentum be sustained beyond the pandemic so we can continue to support those who work day in and day out to improve health outcomes for women. As advocates for gender equality in communities around the world, I know that a lot of this is not new to you. Viruses don't know borders, and the disproportionate impacts seen in Canada have also been observed globally and are further amplified in areas of conflict and fragility. The pandemic is threatening to reverse gender equality progress made in the past decades. For example, the economic effects and financial losses are compounded as women often work more precarious jobs, earn less, save less, and live closer to poverty. And the distribution of unpaid work is becoming more disparate as women assume greater responsibility as caregivers for children impacted by school closures and for older adults as their care needs arise. A pandemic is, by definition, a global event, and as such demands collective global action. COVID-19 has confirmed the interconnectedness of our economies and the importance of coordinated action to mitigate and control the virus and its broader impacts. We have to think about this complex problem not only domestically but globally as well. Even in the midst of a global pandemic, we must continue to advance the sexual and reproductive health and rights of women in all their diversity, as these rights are the foundation of gender equality and achievement of the goals of food security, economic development, improved health outcomes, and better education. We will not resume our day-to-day lives as we once knew them until all populations and countries are protected. Finally, I think it's really important to celebrate our successes and reflect on how we cultivated resilience together and can continue doing so during the next phase of this pandemic. A report released in September by the Global Preparedness Monitoring Board, A World in Disorder, highlighted Canada as the #1 country for women's representation in COVID-19 national response teams. I'm encouraged by the fact that the representation of women in Canada's health leadership positions is increasing, and not just at the national level. I'm proud to be working alongside many strong women who are leading the pandemic response in our provinces, territories, and municipalities. I can see the impact on young girls and their increased interest in science and leadership, which is motivating. I would also like to recognize the significant role of communities in response to the pandemic and building social cohesion. Across Canada, people have stepped up and volunteered their time and displayed acts of kindness and compassion to support those in need. Others have dedicated their time or resources to provide needed equipment and ensure essential services could remain open and available, such as food banks. While widespread public health measures are typically directed by all levels of government, many communities have been quick to develop innovative and collective responses to challenges imposed by COVID-19, guided by the needs of their residents and situated within their geographic, economic, and social contexts. The response to outbreaks and pandemics is stronger when civil society organizations and networks can play leadership roles to support tailored solutions designed in partnership with communities. As leaders in your field, you play an important role in the pandemic response. You are advocates for women and children around the world. I want to thank you and your efforts in working to advance the health outcomes of these groups globally. We will need your voices beyond this pandemic to continue amplifying those of our most vulnerable and to strengthen our foundations to promote optimal health for all, including women and children. The COVID-19 pandemic has demonstrated the complexities of responding to a global health crisis. La pandémie a secoué notre conscience collective et nous a amené à reconnaître que l'équité est essentielle pour assurer la sécurité sanitaire mondiale. This means incorporating a health equity approach to pandemic preparedness, response, and recovery. It relies on leadership at all levels, commitment of all Canadians, and support by a strong public health system. This is the first time in my career that there is a public dialogue on social inequities and health. We must seize this opportunity and continue working collaboratively and in partnership across sectors to ensure Canada's values and interests are represented across the global health landscape beyond the pandemic. It is my hope that we can sustain the momentum gained in the last 10 months and look at this pandemic as an opportunity to both address deeply entrenched health and social inequities and long-standing gaps in our global health systems moving forward. The bottom line is that no one is protected until everyone is protected. I wish you all a successful meeting. Stay safe and healthy. Thank you. Merci.